Hi everyone, welcome back to Mobile Care Physical Therapy. For those who don't know me, my name is Dr. Regina. I'm a founder and CEO of Mobile Care Physical Therapy. Today I'd like to take you along to this video, which we're gonna go over and assessing and testing for diastasis recti during pregnancy. You can check out my first video about diastasis recti and what to avoid, things to do and not to do, for details. But today we're just gonna go over testing for diastasis. I hope it will be informative and helpful to you while you enjoy your journey of being pregnant. Just like in my first video, by the third trimester, most if not all women will have some sort of degree of diastasis recti. So we try to do the preventative exercises and positions, postures, movements. Unfortunately, we're still going to have it because when the belly needs to expand, we're going to have the tissue, which is called linea alba, that keeps the six-pack muscle, right, rectus abdominis muscle together, will be stretching out, causing the diastasis. So with that said, let's get to checking it out. I'm 35 weeks pregnant, and I wanted to show you what the diastasis recti look like, and we're going to assess by measuring how many fingers we have in depth and in width. So first, by looking at the belly, if we see that the belly button is sticking out, that's the first indication that we probably have a diastasis. Second is when you see the stretch marks of the belly. That's another indication that one can have and is having a diastasis. And the next one, third one, is if you poke around above, all around, and below the belly button, I feel that thinning of the connective tissue, which we call linea alba, that connects the six-pack muscle together and holds it together. I could feel that there's a lot more thinning here now at 35 weeks than it used to be before. For example, at 30 weeks, I was not even near to what I am right now. And the reason this is happening is because, as the belly grows, and I tend to personally carry all in the belly, so the baby is all in the front, and that tends to stretch it out and thin this connective tissue, linea alba, more so as opposed to those that carry more in the pelvis, in the back of the pelvis. So again, during pregnancy, it's totally normal and very, very common. However, it could be problematic in postpartum. After you have the baby, studies show that between 4 to 6 weeks it starts to get better by 30 to 40%, and then by 60% it gets better around 6 months. So we still have, if somebody still has that separation and we go back to working out, doing core exercises and really stressing this tissue and the muscles and really not working on intra-abdominal pressure, this could be problematic because one, we're not using these muscles properly. Two, it can cause hernia. And if we continue with that, it's only going to worsen the diastasis recti. So now I want to show you what it looks like and how to measure for the diastasis recti in the lying down position. So the proper way to lie down at this point of pregnancy is to lie down first side lying and then turning on the back. And things to avoid, again, you can check out my first video for different things to avoid to prevent the diastasis from getting worse and making it worse with those activities. So the way we test for diastasis is we'll lie down on the back with the knees, hips and knees bent like so in hook line position. Then what we do is we slightly bend the head up to really measure. But first we need to put fingers. I'm gonna put my fingers up at the belly button to really measure what the extent of the diastasis is. I'm gonna start with 2 fingers, put it at the belly button, lift slightly my head up. It doesn't look like it's 2 fingers, I feel like it's more. I'm gonna try 3 fingers, lift the head up slightly. It looks like it's almost 4. Now we're gonna go above, 2 inches above the belly button. And that feels like it's 1 finger. Now we're gonna go down 2 fingers, or about 2 inches down below the belly button and test it that way. Slightly bring the head up, and that looks like I have 2 fingers below the belly button. Now this is my 4th pregnancy, and with my 2nd and 3rd, I had about 4 to 5 fingers of separation, which I had to go through lots of treatment before getting back to doing planks, any type of core workout, really managing my intra-abdominal pressure, and with all the activities during the day, daily life, and with exercises. So it's very important to really manage that intra-abdominal pressure, not to cause more separation and prevent it from healing and slow down the healing. One more thing I wanted to show you that indicates diastasis is when we and one of the things that we should be avoiding by getting out of bed is by jackknifing. And basically, if somebody presents with the doming, which is like coning shape of the belly, I'm trying to bring my head up to see if I have the coning. I do. I'm not sure if you could see that. Let's show it this way. Yes. So when I lift up, you could see that this is going up into coning or doming, some people say. So that's another indication of the diastasis recti being present. I'll just show you another view of testing for doming or coning of the belly that indicates the diastasis. So I'm gonna raise my head up to see, and if you see, this is really like coning up. It's not showing a lot of it, which I think is a good thing, because I've been working really hard during this pregnancy to avoid that intra-abdominal pressure to make the diastasis worse, or preventing it from getting worse. I hope this video was informative and helpful to you while you're enjoying this precious time of being pregnant and the journey of it. It's just a precious time. It's a very good time to really enjoy it, and I hope this was a good tip for you to prevent it from, and knowing what the diastasis is and how to test it. And if you like the video, put the thumbs up, subscribe if you're new to the channel, and comment below with any questions or any comments that you might have. And you can always go on our website with any questions or things that you want to find out. If you want to sign up for a free 15-minute consultation, please feel free to sign up by going to our website, www.mobilecarept.com, and we're always here for you with any questions that you have regarding women's health or pediatric physical therapy. Until the next time, take care all.